that's a couple of days to figure out.
That's fine.
So,
Next week is fine.
yeah.
I anticipate as our hospitalizations start coming down, and they have been, that somewhere next week, perhaps the week after, we will start seeing deaths come down.
Yes.
I'll show you what I'm.
College, and then I think she finished her pre-med.
Now, the one thing I really want to be very clear of is, while it's generally good news that our case rates are coming down and our hospitalization rates are coming down, they're coming down from just an extraordinarily high place. And our current cases are still twice as high as the peaks that we've had over the summer. We've probably undercounted deaths. We're counting COVID-related deaths in the hospital. There's been so much excess mortality, deaths that haven't been counted, that were COVID-related, that we didn't realize were COVID-related early on. People who have avoided the hospitals because of COVID, heart attacks that happened at home because people were reluctant to come in. So I think the death toll from this past year is just going to be extraordinary. It already has been.
I'm a bigger believer. Every day is a renewal.
Yes, the guidance that has been put out has not always reflected the CDC work entirely. And so we want to make sure that all of that guidance is scrubbed, and that when people come to the CDC website, they know that they're getting the science as the CDC wants to portray it. I need to lead this agency with trust and transparency. I need to make sure that I'm communicating the extraordinary work that the people within the agency are doing. It's not a perfect place, but it's an extraordinary place, and I think we will admit those places where we may have not had perfect outcomes over the last year. Who's going to be perfect in a pandemic? And we're going to learn, and we're going to grow, and we're going to be stronger. And in the process, we are going to be dedicated to the health of this nation, and importantly, to the equity of health in this nation. We are losing life and hope at an alarming rate.